Joining us now is Dr. Jeremy Kenter, Chief Medical Officer at Ally Medical. Thanks for taking the time this afternoon.
Thanks for having me.
Well, we know that cases are rising. How concerned should Central Texans be about possibly contracting monkeypox?
So I don't think you have to be too concerned right now. It looks like the evidence is pretty clear. Most people that contract monkeypox are a subset of individuals that perform any risky behavior that makes them more susceptible. For just the average day-to-day person, you're not going to see monkeypox spread that quickly unless you have close, intimate contact with someone else.
So that kind of leads me to my next question. With school about to start, parents obviously have been through this pandemic now for more than 2 years. They're concerned about the health of their kids going back to school. Should monkeypox then be something to add to that concern?
I wouldn't be concerned about your children going to school. If they are going to contract monkeypox, it's probably going to be by someone in their close family that has it first. So I don't think they're going to get it from schoolmates that they go to school with.
We're all familiar now with COVID testing, which has become pretty easy for most families now. What's the procedure for diagnosing monkeypox?
That's a great question. This one is a little bit different than COVID. The testing procedure that you have to do is a swab, but it has to be done on a rash. So unlike COVID, where you can be tested and be asymptomatic, or you can be tested early on in your illness, until you develop a rash that looks to be consistent with monkeypox, you really can't test for it.
We've heard if you contract this virus, the isolation period is actually longer than what's recommended with COVID. Is that the case? And if so, how long should someone isolate if they do contract the virus?
No, that is true. The average course of illness is going to be 2 to 4 weeks. So about 21 days is 21 to 28 days is what you're going to have to isolate for. Really, it's all dependent on the rash. When you develop a rash, what happens is you get little blisters. They eventually pop and then kind of scab over. Once that's all done, that's when you're no longer contagious.
Final question, Doctor. Vaccines. Who should be concerned with being vaccinated for this specific virus?
Yeah, so currently the vaccine that works, there's 2 different candidates, but both of them were actually made for smallpox. They are great vaccines. The efficacy is 85% or higher, but most people right now are recommending only those that are high risk. So typically in the population right now, men who are having close, intimate contact with other men are the ones that should be vaccinated. Those, or if you work at a laboratory where you test and do DNA sequencing on monkeypox.
Great information. Dr. Jeremy Kenter, Chief Medical Officer of Ally Medical. Thanks for again joining us here on KVUE.
Thanks for having me.